So I am a point of care ultrasound enthusiast, and I happened to hear my friends talk about it, and my interest piqued, and I told him I wanted to get involved in getting well trained so that I can help to train my people at the hospital and other people I might be able to train. The main goal of this training program is to pick people like me, healthcare providers, particularly doctors, found in the districts who have limited access to advanced imaging, train them to be ambassadors of point of care ultrasound so that we are able to do more for our patients than we are currently doing now.
The training has been very packed and tiring, but I think it's been good so far. You are able to understand the image you are seeing, and you are able to give a better interpretation of the image. People cannot afford basic investigations. Ultrasound is cheaper and it's quite safe to diagnose things as quickly as possible, to at least have an idea what's going on in their body.
Taking part in this program give me the opportunity to expose the program beyond the borders of Ghana, and also increase the awareness of point of care ultrasound in the Gambia, which can culminate into further POCUS trainings in the Gambia.
Point of care ultrasound right now is the new kid on the block. It gives you a lot of diagnostic information real time. It's a very crucial diagnostic tool when used correctly, and it helps patients get better quickly. And also, I've come to realize that some patients kind of feel happy that you are using something complex to help them get better. So in a wider sense, the goal is to also train as many people as possible, get the word of POCUS out there, spread the gospel of POCUS to everybody that is there, because it is a gospel worth hearing. Apart from the stethoscope, POCUS is something that you need to learn to become a more complete doctor.